My name is Sanae Midorikawa from Miyagi Gakuin Women's University. I am pleased to report that we have participated in the Preventing Overdiagnosis Conference (PODC). The PODC had its first meeting in September 2013. The conference broadly discusses the definition and current state of overdiagnosis, method for identifying overdiagnosis, drivers of overdiagnosis, and how to communicate about overdiagnosis. I attended my first PODC in Sydney in December 2019, and I was very surprised to see overdiagnosis being widely discussed. I was unable to attend for a while due to the COVID-19 pandemic, but I was finally able to attend this year. The 2023 PODC was held in Copenhagen, Denmark from August 14 to 16. The venue was the Scandic Copenhagen, a hotel in the center of Copenhagen. There were 370 attendees from 25 countries. The 2023 PODC invited abstracts on 6 topics, such as clinical solution to reduce overdiagnosis, factors that promote overdiagnosis, communication about overdiagnosis, and so on. These topics were discussed in different sessions as shown in this slide. The keynote sessions were held on these 6 requested topics in the large conference hall shown in the photo, where all participants could gather. There were several presentations on each topic, followed by discussions. Workshops and seminars are more in-depth topics and are divided into 6 smaller rooms for discussions, group work, and lectures. Oral presentations were given in a room of the same size, followed by a library questions and answers. I would like to talk about what I found impressive about each session. Although there were not many cancer screening topics at this year's meeting, several abstracts on breast cancer screening were presented. In order to reduce the overdiagnosis of breast cancer, it is necessary to consider the method of screening, the target age of subjects, and the interval of screening. At this meeting, the age at which breast cancer screening should be performed was discussed. Breast cancer screening is more likely to cause overdiagnosis in the elderly, and it was pointed out that overdiagnosis would increase if people beyond the target age were screened. From Japan, a professor of public health at Teikyo University reported that there is no upper limit for breast cancer screening in Japan, resulting in overscreening of the elderly. Some reports also discussed how to educate those who continue to be screened for breast cancer after the age of 70 or 75 about the harms of overdiagnosis. Also impressive in the oral presentations was a study conducted in the Flanders region of Belgium. The semi-structured interview study was conducted asking medical professionals and public health administrators providing screening programs about their knowledge of overdiagnosis and its harm in cancer screening, prediction of specific harm of overdiagnosis, and willingness to inform their target populations about the harm of overdiagnosis. The result showed that few people knew the term overdiagnosis and understood its harm. If medical professionals and administrators involved in screening do not know about overdiagnosis and its specific harm, they cannot provide accurate information to the population. One of the main reasons why the problem of overdiagnosis is not well understood by many people is that professionals are either unaware of overdiagnosis or underestimate its harm, even if they are aware of it. I think this situation exists in Japan as well. Poster presentations were displayed on a board in the hall outside each venue for 3 days, and we can see them at any time. I gave a poster presentation, and I would like to introduce the contents of my presentation. Adequate information about potential benefits and harm is essential for making decisions about participation in screening programs. Thyroid cancer screening is generally considered harmful and is not currently recommended. However, thyroid cancer screening has been conducted in Fukushima by local governments and Fukushima Medical University since immediately after the nuclear accident in 2011. Influencing factors need to be considered when providing people with decision-making information. We aimed to identify factors associated with the decision to participate in thyroid cancer screening in Fukushima using a scenario-based questionnaire survey. The participants in the study are female university students of the same age as the subjects. The following scenario is first presented to the participant. At the time of the nuclear accident, you are in the third grade of a junior high school in Fukushima, and you are a subject of thyroid cancer screening. The screening was free of charge. You have already taken the examination twice. After presenting the scenario, we asked whether or not to participate in the thyroid cancer screening, reason for participation or non-participation, estimation of the potential benefits and harm of thyroid cancer screening, and risk perception of radiation exposure and carcinogenesis. Next, we provided the information handout currently used in Fukushima Prefecture and asked for a similar questionnaire. This handout does not use the term overdiagnosis. It also does not explain the specific harm caused by overdiagnosis. And then we provided a leaflet on thyroid cancer screening and overdiagnosis prepared by the NPO we work with and asked for a similar questionnaire. The leaflet explains the specific harm caused by overdiagnosis and that thyroid cancer is unlikely to increase under the exposure conditions in Fukushima. In addition, the subjects were given a detailed lecture on radiation exposure and health, the exposure situation in Fukushima, and the clinical characteristics of thyroid cancer, and the harm of overdiagnosis. The same questionnaire was then administered again. The percentage of those who said they would undergo thyroid cancer screening was 75% after the scenario presentation and 60% even after reading the current handout, but significantly decreased to 19% and 11% after the leaflet distribution and lecture respectively, with a significant increase in those who said they would not undergo screening. The percentage of those who perceived screening to be more harmful than beneficial increased significantly after the leaflet and lecture, compared with the current handout. And decision-making at each stage was significantly related to perceived potential harms. On the other hand, the risk perception of radiation-induced cancer decreased with each step of the handout, leaflet, and lecture, although decision-making at each step was not related to the cancer risk perception of radiation. These results suggest that not only radiation exposure and radiation risk perception, but also the estimation of benefit and harm of thyroid cancer screening may be important factors in the decision to undergo thyroid cancer screening conducted after the nuclear accident. Therefore, appropriate information on the harm of overdiagnosis in thyroid cancer screening should be provided. The abstract of the presentation at this meeting were published in the British Medical Journal. The next POCD will be held in Oxford in September 2025. On each day of the conference, hospitality was provided before the start of the sessions. On the second day, the hospitality included a light stretching session with the audience joining in and singing a dove song at the end. The song was Bridge Over Tomorrow by Simon and Garfunkel, with all the lyrics about overcoming overdiagnosis. These pictures are from the Danish summer landscape. Thank you for your attention.